Relief could be on the way for healthcare workers across Illinois, relief that could save their jobs. Last week, the state lawmakers voted to streamline the license renewal process for healthcare workers, many of whom otherwise would have had to wait several months or more. Illinois Capitol Bureau Chief Max Cotton explains.
The Illinois Department of Financial and Professional Regulation is facing a crisis. License renewal applications, particularly in healthcare fields, are taking as long as 6 to 8 months.
Calls of people whose job offers are about to be revoked, of people who want to practice in nursing, for instance, who can't go to work the next day because their license has lapsed and they applied 6 months ago, right? This is not something that is any professional's fault. This is really something the state has to fix.
Representative Morgan chairs the House's Healthcare Licenses Committee. He decided to step in and create that fix. When lawmakers returned from the veto session, he sponsored legislation giving IDFPR the power to streamline renewals for 1 year and require the agency not to let it happen again.
This gives the department the power, in fact, the mandate to renew automatically those licenses if the department falls too far behind.
The bill would also require IDFPR to invest in a new IT system in the next 6 months, one which would prevent future backlogs. It passed both the House and Senate with broad bipartisan support.
This bill is a step in the right direction. We have a long way to go. We must and will hold IDFPR accountable so that we never go back to the failed system again.
I think, again, a great example of what can happen when everyone works together.
Morgan says automatic renewals would only apply to renewals, not new applicants who must pass a more stringent check. People who've previously had their licenses suspended or are under professional review would also be ineligible. In Springfield, Max Cotton, WGEM News.